glaucoma as a disease is a second leading cause of blindness. To understand the enormity of the disease, if I could just reel off the World Health Organization statistics, it says that as of date, 4.5 million people are blind from glaucoma disease, and 60.5 million people world over are suffering from glaucoma. So look at the enormity of the numbers, and that tells us that this disease has to be diagnosed as early as we can so that we could ensure that the patient has a life where he could visually manage with the stars even in this kind of a dreaded disease. What we also need to understand about this disease that is it's a silent killer, it's asymptomatic, excepting in a particular segment of population whom we call them as angle closure attacks. In this disease, being a silent killer, the patient is totally unaware that he has got the disease in his eye, and it is only in the advanced stage of the disease when the disease starts gradually making the patient lose his vision from the periphery to the center, and he comes to a near tunnel vision with a major handicap in his day-to-day activities, which is when he would come running to the doctor if he is to understand the symptoms. So it becomes necessary that glaucoma as a disease be evaluated as a routine component of evaluation. And who are the patients who are going to be afflicted by glaucoma? A person could be born with a glaucoma, like a child could have a congenital glaucoma, wherein the parents may not be able to diagnose it because it could be asymptomatic, or it could present with a very large eye, or it could be a watery eye, or the child would be not able to look at light, or which is called as photophobia. And when the parents take the child to the pediatrician and who refers him on to an ophthalmologist, or it could be a disease which is more commonly seen above the age of 40, wherein it could be associated with the family history, wherein genetically the disease is passed on as a hereditary disease, or it could be because of steroid intake. So a person, besides undergoing an eye examination, a vision check, it's important that every single patient undergoes an intraocular pressure check, and on a slit lamp evaluation we decide what is the chamber depth. Now, why measuring the chamber depth becomes important is there are this segment of people who have a narrow anterior chamber depth, and when you notice that a person has a narrow anterior chamber depth, you should be thinking of a narrow angle glaucoma. So then, it is something which is picked up in a routine eye examination. The other very important take-up is called the measure of the intraocular pressure, which is done by the gold standard of applanation tonometry. There are other ways of measuring the IOP, but the gold standard is an applanation tonometry, wherein you are able to measure the intraocular pressure of the eye. And when there is a suspect that it is not within the narrow normal range, then you immediately, it sensitizes you that there could be a possibility of glaucoma. Then you delve further into the history of the patient, asking whether there are any family members who are afflicted with the disease, or there is an injury, or there is some intake of drugs which could coexist with this disease. And when there are certain clinching issues which is there, even just a solitary stand of a raised intraocular pressure itself would mandate that you go on to the second step. Then you would advise the patient that there is a suspicion that there could be a disease lurking somewhere. So you would take them to the field analyzer, which comes as different machines. We have the Humphreys or the Octopus field analyzer, wherein you are able to do a measure of the field of vision of the individual, because this glaucoma as a disease, it's the pressure, intraocular pressure of the eye, which tends to get raised and starts pressing on the optic nerve, or the very important nerve of the eye, and gradually it starts killing the neurons of the eye, and gradually there's a constriction in the field of the vision to becoming narrow and narrow to a tunnel vision to ultimate blindness. Armed with the information provided by the field analyzer, the OCT, and the optic disc evaluation and the fundus photograph, you are able to conclusively decide that yes, this patient has a glaucoma disease. Once you have diagnosed the glaucoma disease, it becomes very important that you counsel the patient. This untreated, this would gradually completely take the vision out of the individual. So we need to be aggressive and immediate in our management strategy, which could be a medical management or a surgical management. All in all, what I would like to conclude saying that this is a disease where one needs to be very wary of, and if you're able to take care of this patient at the early stage of the disease or even in a moderate stage of disease, you could keep it in good control and manage to maintain the quality of the life of the individual for any number of years.